Good evening, friends. I'm Dr. Ajay Shah, bringing you this another great evening live. Today, I have a special guest, matter of fact, a great guest, actually. Let me give you a quick page update. We are more than 100,000 followers now. We are also doing this almost 3, 4 times a week at cooking demonstration with my wife. All our lives go on YouTube in few hours. So if you miss a live, or if you cannot watch the whole live, you can always watch it on YouTube later on. So let's tune in with Dr. Alicia Williams. She's our guest today. She's a cardiologist, and we actually both have something in common. She actually now practices functional medicine, just like I practice lifestyle medicine. She has been also a preventative cardiologist. She's a lifestyle coach. She's a great friend. As a matter of fact, the thing I absolutely admire her about is that I actually was trained under her at Sinai Hospital in Detroit in 1989. So we go back 30 some years, 30 plus years actually. So that's a great thing to have Dr. Alicia Williams come on our page. Welcome, Dr. Williams.
Thank you so much, Dr. Shah. It was such a pleasure when I saw you again after many years. And I think we're doing pretty good. I think in general, hopefully we're inspiring our colleagues to be healthier. And so it's been an honor to be able to work with you again, and especially to see the work that you're doing.
Oh, thank you very much. Yeah, I think I definitely admire your passion, your own health, the way you help people. You're branching out into, functional medicine now. I think many cardiologists cannot take that leap. And I think I've done it, you have done it. So I think we need more cardiologists to do it. So let me ask you a first question. Where do you live now and what kind of work you do?
Well, at the current time, I'm in mid-Michigan. So I moved from the Kalamazoo area about 3 years ago to be closer to family. And I'm living just a little bit east and north of the Lansing area. And so I started at a practice called the Center for Optimal Health. And Dr. David Posset started that practice, and he's a functional medicine and a nutritional expert in bioidentical hormones and natural therapies like prolotherapy, but has a great interest in trying to help people reverse chronic disease. And I had met him a couple of years back, and I realized that I wanted to go from being a full-time cardiologist in non-invasive cardiology to being more integrative and more prevention and reversal of heart disease. I just found, and I know you feel the same way over the years, just seeing people come back again and again with the same problems and the same issues, and it was getting worse. We were seeing younger people, and we were seeing people coming back for multiple stents. And so when I first started in Kalamazoo, and I really loved my practice there, I just was fascinated with ultrasound and non-invasive techniques, sports medicine and cardiac rehab. And I was very fortunate to be part of a program called the Coronary Health Improvement Project. So Dr. Hans Steele came, and he stayed. We had like a bed and breakfast for 2 years and had many of the wonderful leaders in plant-based medicine that stayed at my house and came to speak through his program at Borges Hospital. And that was a wonderful experience because at the time I wanted to get the Ornish program at Borges, but it wasn't at that time reimbursable through Medicare. So when the CHIP program came through, it was a good experience. And at that time, I continued to be interested in nutrition. And so now I'm trying to follow through on some of those things, including functional medicine, which I've spent the last at least 20 years intensively training in that area because it really blends well with traditional medicine.
No, I think this CHIP program with Hans Steele is one of the most successful programs. It's very cost effective.
Yes.
And I think it happens in a group fashion. So there is some kind of camaraderie. There's a lot of hand holding. There's a lot of demonstration of cooking and other things. And I agree, Dean Ornish program is another great program, which fortunately now Medicare covers it. And I think that program actually many cardiologists should look into it because it pays well, because insurance companies have realized that Dean Ornish type program actually may have to pay upfront small costs, but in the long run saves thousands and thousands of dollars. I mean, saving one bypass surgery is almost $60,000 to $100,000, and many of the Dean Ornish program can reverse some of the heart disease. So I think I'm glad you are into it, and I think more cardiologists need to get into it. But I really want to talk about something which you are kind of now specializing into it, and that's autoimmune disease. And particularly in women, as we know, women almost, as I understand, almost have like 3 to 4 times more frequent autoimmune disease than men, including Hashimoto thyroiditis and many other autoimmune disease. So please tell us a little bit about autoimmune disease in general, and then autoimmune disease in women. Like, are there any lifestyle factors which plays a role? How do we diagnose it? How do we treat it? And how can we prevent it?
Autoimmune disease, I became interested early on because I would see women coming in with lupus that had classic chest pain, classic symptoms, and yet they'd have a heart catheterization and the arteries were open. And we realized at that time that obviously something was going on. And when we see these autoimmune diseases, what it is it's the body fighting itself. Your immune system goes into a mode of being too active, and it starts attacking itself. And so there can be many different things that happen. For example, you can have psoriasis and psoriatic arthritis, rheumatoid arthritis, lupus, myasthenia gravis, and even colitis. You know, we never thought that the GI illnesses increase risk of heart disease, but now we know better. These things can not only attack the arteries because of inflammation being out of control, but it can cause the heart muscle to stiffen and weaken. It can cause artery issues in the big aorta, depending on the type of autoimmune disease. I see quite a few women now with POTS, or postural orthostatic tachycardia syndrome, where they can't control their blood pressure adequately. Their autonomic nervous system is out of balance. So when they stand up, their heart races, and a lot of times they pass out. So when we look at these disorders, you've got to really look back to some basics, and that's where functional medicine can help us. Because when we look at things as far as medications, you might be able to control a symptom, but a lot of times people don't tolerate medications. And so with the help of functional medicine approach, you really look at the gut first. Because if the health of the gut is not good, especially the bacterial balance, you get a lot more inflammation. And now we know that not only the gut, but the mouth bacteria can travel to the brain. It can cause problems with the autonomic nervous system, and it can cause enhanced inflammation. One of the things that I really became interested in was gluten intolerance. I have horrible gluten and dairy intolerance. And so the more that I read about it, I realized that there was a lot of this autoimmune issues that come about with that particular issue. Not that everybody has that, but that there's certain people, if you don't identify certain types of foods that they react to, it makes it really hard for them to feel better. And then you look at things like really becoming deconditioned because of that. So when you have arthritics, or you have the postural orthostatic tachycardia syndrome, you have to really work on core strength, because everything they do takes more energy. So really the lifestyle medicine, the functional medicine, is really an excellent approach to these women and men, but especially women with autoimmune disease. And also being very careful identifying risk factors for them and symptoms that might be real subtle, that might be a sign of poor circulation, not only the heart, but the brain, the extremities. And I think that when you look at lifestyle medicine, especially the quality of the food, the amount of sugar, the amount of processed foods, chemicals, pesticides, people can't get rid of those easily. They can't detoxify those things as easily because their immune system is not working properly. Their GI tract isn't working properly. So they need help really cleaning up their diet, and also help, of course, with stress and sleep. So all the things that you talk about are really the core basics, whether you're dealing with the heart or another organ system. Because even if you can't cure an autoimmune disease, if you take away as many triggers as possible, they have the ability then to be able to function at a higher level. One of the things in functional medicine we do is take away the things that are irritating the body. So whether it's a food allergen or a toxin or these types of things like sugar, stress, But you need to also give the body back what it needs. For example, nutrients that they're deficient in. Many times they're not absorbing their foods well. You check their nutrient levels and they're horrible. You check their cortisol and their hormone levels and they're horrible. So anything that you can balance and bring back as close as possible to baseline can help them deal with a lot of their symptoms a lot better.
Wow, I mean, that makes so much sense. And I think I agree with you. This concept of microbiome has just taken off. And I think, like you said, so many factors play a role, including like how a person's birth was, what kind of antibiotic they have used in their lifetime, how much fiber they have in their diet, particularly soluble fiber. And as we know, I think 70% of our immune system resides into our gut, actually. And I think there are more lymphocytes in the gut than even bone marrow and the blood. So I think if you don't have a healthy gut, definitely immune system is going to go haywire. And like you said, a lot of this bad bacteria in the mouth and gut can cause chronic inflammation, including even brain inflammation and Alzheimer and brain fog. And so I think this is a very, very important field for doctors to look into, is the connection between gut and autoimmune disease. So in terms of the lifestyle, like you alluded a little bit, but in terms of the lifestyle, what things people can do? I think we talked about diet, which should be more fiber, more plant-based diet. How about exercise, sleep, and other things?
Well, and especially with the diet, like a lot of people that have autoimmune disease are either constipated or have irritable bowel symptoms. So the more regular you can get that, the better they're going to feel to be able to do things. A lot of times their sleep is disrupted. And it's not just sleep apnea, it can be narcolepsy and other things. So the quality of the sleep, if we can get people moving, and it isn't always aerobic activity with some people that have some limitations, but movement, the foods, you give the signals, the nutrients, try to get them on some high quality nutrients. And then many of them are dealing with stress. And so I think that this is where lifestyle medicine is critical for these people, because you can't just look at the one thing, because it's like they've kind of lost hope and they need someone to really look at the big picture. And maybe one thing won't work, but if you kind of try to give them options, it might be a modified type of yoga, it might be meditation. I don't think there's enough group support, and it's really hard right now with the pandemic, because a lot of the group support things are just a little harder, but with what you're doing online is very helpful for people. I think that trying to get people to learn how to cook, I admire your wife's work so much. One of the things that I enjoyed so much when I did the functional medicine clinic at the Heart Center is Dr. Christina Minger ran a cooking class. And people are they connect to food. And we need to make people joyful about their food and not afraid of it, and not to feel, I tell people, it's not really hard to eat different, it's hard to be sick. So I think that when we look at food as joy, and there's so many foods that we can eat, it really doesn't make sense for people to say, I can't do it. They just don't know how. They need help. So that's probably the core things that people really need help with.
Yeah,
there are some things online, like you're doing with yoga. I think that it makes it more accessible for people to do that, although it is nice to have instruction. And so I think the more that we can get people to learn that these don't have to be difficult things, that they can do simple, basic things, and it does help.
Yeah, I think I agree. I think like we all need to eat food. We cannot eat the knowledge. I think at the end of the day, food is a basic necessity. And that's where the healthy food comes in. And I was figuring it out, Dr. Williams, we eat about 80,000 pounds of food in our lifetime, 80,000 pounds of food. And we take, if somebody is on, for example, on Lipitor, a cholesterol lowering medicine, we take about 1 pound of Lipitor in our life if we start at age 40. So 1 pound versus 80,000 pound food. Just imagine what would have larger impact in your life, 80,000 or 1, So it's just the magnitude of importance of food versus taking one small pill. So, that dives into our next topic, which is about the vascular disease. So please tell us some of the techniques where we actually can help people, both men and women, more so women, how to diagnose heart blockage, even the blockage in the brain arteries, and even the possibility of preventing stroke. How can we diagnose early? And what are the tools we can ask people to employ to not just diagnose early, but to prevent it?
Well, one of my favorite things came about because when I was sitting with a patient that came in with some very strange symptoms, we really didn't think it was heart symptoms, and she had a stress test and it was normal. And she looked at me and she said, "Is my heart okay?" And I had to really think about it, and it hit me. I don't know. We don't know, because when you have the beginning of buildup in the arteries, you can't really see it by a stress test. So part of the problem we realized, especially in women, especially diabetics, when they did a study many years ago, they did heart caths on angiograms on people with diabetes, and they had classic chest pain, they had abnormal stress tests. And when they looked inside the arteries with ultrasound, all of the diabetics had plaque, but you couldn't see it on a normal catheterization because it was layering the artery almost like icing on a cake. So when I realized that study, I thought, oh my gosh, we have to treat people that have diabetes as if they already have heart disease, even if we haven't seen it. So then, because of my interest in ultrasound, I kept track of that. But even ultrasound in the operating room, we would do transesophageal echo going into the esophagus, looking at the heart, even putting the probe on the heart itself during open heart. This was many years ago. You could sort of see things, but now we have the technology where we can look at the carotid thickness, and there's a test called a carotid intima medial thickness. And similar to the calcium score, it gives us a risk evaluation. It's not for people having symptoms. That's different. That's a full carotid ultrasound or something else. This is for, is my heart okay? How can I see some arteries and know what the artery, the skin of the artery, so the lining of the artery, what does it look like? Am I starting to build up plaque? Am I starting to get some narrowings? Is the wall thicker than it should be? Because when the wall thickens, it's a sign of inflammation. If you get enough inflammation, it forms a plaque. So when I looked into technologies and I found the carotid thickness technology, I realized that it had been there for a long time, but because of the software, we didn't have it readily available. And so when I looked into it, you have to be careful because you're measuring very small arteries in the neck. It's millimeters. So there's a couple of companies in the country that all they do is evaluate carotid thickness. And what that allows us to do is, if we take risk factors, for example, blood pressure, cholesterol, diabetes, we look at the basic risk factors, and then we look at the carotid thickness. If that shows us that there's the start of buildup in the arteries, then you're not low risk anymore. You're at risk. And we can look at the risk in a 5 to 10 year period of time by comparing your numbers by sex, age, and race to what the considered normals would be. And that gives you a vascular age. And it's an estimate, it's a derived estimate of that age. It doesn't mean it's not reversible, but it gives us an idea of how many miles your arteries have seen, maybe too many. And then, of course, we have options of nutrition, medications, and then sometimes we do see tight blockages that people had absolutely no idea that they had, and they end up needing a procedure. But fortunately, we're really looking for what's called preclinical disease, where symptoms are not there yet, but we need a guide of what tool can we use to track the risk of a vascular event, either the brain or the heart. And then we can also look at the artery at the top of the leg, the femoral artery, to look at the thickness of that. Those are different ways that you can gauge risk. The advantage of this test in comparison to the calcium score, which is widely available, but the calcium score involves radiation. So I don't like to do it a lot, especially in women. And it also doesn't pick up soft plaque. It picks up just calcium, which is good compared to a lot of things. But when we look at the availability, it just depends on what's available in your area. There aren't as many people trained in doing the CIMT or the carotid thickness. It's not the same thing as a carotid ultrasound. It's definitely not the same thing as Lifeline. It's a very detailed analysis, and it takes an expert to really look at those findings and characterize, tell us, is it soft plaque, hard plaque, mixed plaque, and that helps us with risk.
Wow. I mean, I'm glad we talked about the CIMT because, like you said, CIMT has been around, but whatever the reason, many people are not taking advantage of it. The way I give example to my patient that if you want to look at, like if you look at the one tire in your car, you know how all four tires are. Same way, it's hard to access the arteries on the heart, but the carotid arteries and like the artery in the leg are so easily accessible that you can easily kind of make an educator guess how your heart arteries are, because the process which makes the carotid artery thick and plaque is the same process going to make the blockage in the heart arteries too. So I think plus that's easy to track, the lifestyle changes, the medications, with the serial carotid artery intimal thickness over the time. So I think that technology should be used more. And does insurance cover that technology?
Not yet. They're fighting to try to get coverage. There's a couple of groups that are really nationally, internationally known. You do have to be careful that the people that are doing it, because you're measuring such a small thickness, you can easily skew the results by taking too many measurements or in not the right angles. So that's why having the people that are trained and doing it the same way every time, so that you can reproduce close to what you did the time before for comparison. And I think eventually it will be covered. It's comparable to the cost of calcium scores, although some places the calcium scores are very inexpensive. But the CIMT, you can turn it in through flex spending for the people that have the flex, but it runs a couple $100, so about between $200 and $250. And that includes the interpretation fee, and then at some interval of time, you can compare the results. For example, in mid-Michigan, the calcium scores run a little bit more than that, but I know some places you can go, they're very inexpensive now. So part of it is a cost concern, but I think as far as safety, I always like to avoid radiation whenever possible. So that gives people some options.
So that's an excellent point. I think, receiving a CAT scan radiation, even though it's a small radiation, it's comparable to mammogram, but I think still it's a radiation. One should always avoid it because we get enough exposure of sun radiation, many other procedures, and many other things. So we should avoid all radiation. And that's where I think, to be frank with you, I think $200, $250 for carotid intimal thickness is a very, very, it's almost like an investment. I think many patients, I realize that when we do this carotid intimal thickness or calcium scoring, a lot of patients gets a different motivation when I tell them that their plaque buildup is already there. And when we can show them, or we can show them the calcium score, somehow they get more motivated to do lifestyle changes. They also get excited to have a serial follow-up. They also get excited to continue taking their medication for lowering the cholesterol. So I think that definitely is a big motivator because picture speaks more than just words from a doctor's mouth. I think when patient can see a picture, they actually get more convinced that there's already plaque buildup. So I think, how do you use carotid thickness in your practice? Like patients come in and then you have high risk patient, you order it, the results come back, and how do you counsel them?
Well, what I do in my practice, it's a couple different options. Some people will come in, since I do the test myself, some people will come in as a referral. But the reason I like to do the test is I like to educate the patient after the test is done and actually show them the pictures, and then they'll get the final report. And sometimes they'll go back to their physician to follow up. If it's a patient of mine, I like to show them the images and kind of explain that, okay, there's another step to this. Let's look at your risk factors in more detail. Let's look at the inflammation markers in more detail. And when we look at the risk factors that are reversible and treatable, it gives them, it empowers them instead of just giving them information that they feel overwhelmed. It can be overwhelming to see the arteries. It's also very beautiful. And so I try to encourage them that there is a lot of blood flow, but we have some work to do. And so it gives you a chance to kind of ease them into not being fearful of a diagnosis, but to say, now we have information, now we can move ahead and do something about it. And then the labs, I don't know if you want to talk about that now, the labs that I usually will do to kind of go hand in hand, because when we look at risk, the CIMT or the carotid thickness or the calcium score gives us somewhat of the anatomy, and then the labs give us the chemistry. And the normal labs that we get a lot of times are really very abnormal. You get blood sugars out of control, but sometimes they look pretty good. So when you have someone that isn't obviously at risk, maybe a little of this and a little of that, that's where the carotid thickness can help to what we call risk stratify. We get them into a different category and say, you know what, you're not as low risk as you think you are, but we have things we can do. Or maybe their arteries look great, and then you tell them, okay, let's keep up with stuff. Let's look at some labs and then recheck. Because sometimes one interval of time, it won't look bad. But then if you're suddenly changing within a year or two, suddenly thickening or building up plaque, you're missing something. And then just like a puzzle, you're trying to just peel away and say, what else are we missing? And a lot of times it's the basics, but sometimes it gets into, more unique things like toxins and metals and some of those things. But we have plenty usually to deal with right out the gate, because the basics, everybody's trying to deal with the basics pretty much.
I think that's an excellent point, that many times the traditional risk factors, many may not pick up the disease. And I think we know now that, even from Framingham, that people who are at risk between 10 and 20% 10-year event rate, if their calcium score is high, or if they are having high carotid intimal thickness, the risk becomes, like 10% over next 10 years. So I think definitely it's risk stratifies in a better way in a low risk patient particularly. So I think there's definitely benefits. So let's jump into some of the common labs would you order when you are dealing with a person who is trying to prevent or even possibly reverse vascular disease, including heart disease, carotid disease, even leg blockage. So some of the common labs and other tests you order.
And also I'll go through that, but it's an important point. A lot of times women are, when you look at their risk comes out quite low when you look at the normal scoring systems. So that's where some of these other unique things can really help to define the risk a little bit better. For example, with women that have had PCOS or polycystic ovarian syndrome, or gestational, so during pregnancy, diabetes and hypertension, we miss the risk. And so that's where the CIMT can help, or the carotid thickness, to say, you're not as low risk as you think. With the labs, we miss a lot of chances if we don't check some labs. Besides the basic lipids, I know you talked to Joel Kahn about the lipoprotein A. I had been checking that for 20 years, and I know that initially we thought we can't do much to bring the level down, although there are some things we can use. But the more important thing is that we can make the other risk factors as good as they can be. So it gives us one gauge. So lipoprotein A is very important, even with the normal cholesterol, especially if someone has premature artery disease in the family. The other thing that's frequently missed is homocysteine, and that's the methylation marker. So your B6, B12 folate, if you have the MTHFR gene, which many people do, it's so complex now. I haven't really kept up with all the new developments, but it's incredible, not only for heart, but for brain health. That's a blood test. If you look at nutrient levels like vitamin D, B12, these are missed many times. Even things like we can measure coenzyme Q10 levels, which is important, and fatty acid balance. So when we have inflammation, which is another thing that I'll go through, if we don't get some of those other levels in balance, what happens is we can't get rid of the inflammation because we're not absorbing the nutrients. So when we look at these basic nutrients, many of the people that I check end up being low. There's a lot of opportunity now. There's Boston Heart Lab, Cleveland Heart Lab, Quest, a lot of times will be able to do that affordably for people. The other thing are the advanced inflammatory markers. These are incredible. So besides the C-reactive proteins, so how do we know our bodies are on fire? The high sensitivity CRP is widely available. Anybody can get it. But that doesn't tell us where the inflammation is. If we target it with our more advanced inflammatory markers, we have our myeloperoxidase, so MPO, and we have the LP plaque, which is the lipoprotein associated, that's another white cell marker. So when you have inflammation that are involving the white blood cells being hyper alert, and especially when they deposit inside the artery wall, then you have then taken that person to a much higher risk of plaque rupture. So those two are very important. MPO is linked with dental health, and you can have an abscess that you don't even know about. And if the MPO goes up, then one of the things you need to talk to your dentist, because some people will just have sinus congestion, but they had an occult abscess that's causing problems with inflammation in the body. The other thing that we can do is the metabolism. I mean, besides the 3-month blood sugar average, we can look at insulin blood sugar fasting in 2 hour. We can look at the genetics I don't get as much into, but there are a couple genes. And one resource I would highly recommend is the Baldonine Guide, which is Beat the Heart Attack Gene book. Because if you look at the way they approach, they were on target all along to what now is recommended for the prevention and reversal using traditional methods, but also some nutritional things too. So that book, Beat the Heart Attack Gene, can give people a lot of very good information about some of the testing and labs that should be checked.
Wow, no, I think you comprehensively cover what a person should have it done if they want to prevent, and even how to track their known disease and reverse it. I think that book you recommend I read it, and it's very, very excellent book. I think it goes into all the details, has like pages on each lab, and I personally believe that knowledge is power. Obviously, knowledge has to be applied, but at the same time, it starts with acquiring the knowledge. And that's where I think, thanks to doctor like you, and we are also spreading this knowledge. But I also highly recommend all our viewers that be your own investigator, read more books, read more YouTube videos, go to conferences. Right now they cannot, but there are a lot of lay person based conferences into lifestyle medicine, into functional medicine, where they actually target an average individual who is not a doctor or a medical personnel. And I think, to me, health should be #1 goal, in my opinion, for every individual, because if health is there, everything else is there. So I'm glad we covered this comprehensively, this labs. Let's quickly go into the women and heart disease. That's very, very important topic. 60–70% of our followers and viewers are actually women. Women are just more apt to acquire the knowledge, help the family. They actually many times take the lead in making the family healthy. Even many times, many husbands I see came to see me because the wife told them to come and see me. So I think I take a mission to educate as many women as possible. So let's start with what are the different symptoms women get when they get heart disease or heart blockage, and how can a woman make sure that they don't miss a heart attack?
Yeah, this is critical because each year I was involved in the American Heart Association, the women's group in that. And so many times young women would come up saying, I never knew I had symptoms. Some of the symptoms are the same as men, but I think women tend to not pay attention as much. But probably I've seen women, especially that are excessively tired, breathless with exercise. A lot of times they write it off as just having a lot of caretaking responsibilities or trying to work and take care of a family. But what frequently happens, and this is unfortunate, is things like blood pressure. Blood pressure, usually there's no symptoms until all of a sudden, something happens. So a lot of times it can be from blood pressure, it could be from circulation, and even in autoimmune disease, women can get a Raynaud's where their fingers turn blue or their toes turn blue, commonly in the fingers, and that's the little blood vessels. So we know a lot more about that. So the microcirculation, not even just the big arteries, can be impacted. You can get symptoms of chest discomfort, but I've had people come in and say they had mashed potatoes stuck in their throat. That's the only symptom they had, or between the shoulder blades, or down the arm in the pit of the stomach, and they thought it was indigestion. And I think that if something is persisting, it's better just to check it, because it's so easy to get an EKG. I'll never forget a young woman that I took care of. She was 28 and she went to 6 different emergency rooms until they did an EKG. And this is many years ago, but she had had a heart attack and she ended up with bypasses at the age of 28. And no one wanted to believe that she could have heart disease. But especially in families where you have early onset heart disease, women have to remember they're not immune from that. And there are certain genes that can impact them. And sometimes you don't know your genetics. So it's important to really take that into consideration. If you did have problems during pregnancy with blood pressure or with diabetes, you're automatically at higher risk. If you have had cancer treatments or radiation therapy to the chest, much higher risk. And sometimes those women don't have chest pain. They just have pressure or tightness or breathlessness. And of course, things like the Takotsubo or broken heart syndrome, where the heart suddenly weakens during a stressful event. And I'm sure there were many, many women that either passed away because they didn't know, or delayed going into the hospital because they just figured that it was stress or a panic attack. I think one of the most common things I see with heart rhythm issues is, and this was something that's gone on for a long time, is women were diagnosed with panic attacks and they had an arrhythmia. They had a tachycardia or an atrial fibrillation. So we don't want to ignore these. And even mitral valve prolapse, which we used to think was benign, and most of the time it is, we now know that when the mitral valve is floppy, you can get some remodeling of the heart muscle, and people can get arrhythmias more often than we realize. And so when people have kind of a fluttering or dizziness, it's better just to check it. And then even treatments besides chemotherapy, treatments for these autoimmune diseases, if they're on steroids, if they've been on hormone replacement, birth control, or hormone therapy, a lot of times that can change the cholesterol levels, and it can even change the gut bacteria. So some people will just get GI symptoms. So it can be very subtle.
Wow. No, I think we covered a lot in this women and heart disease, and I agree with you. I think so even though symptoms are different, women are many times after particularly menopause, they are at equal risk. And many times after age 65, 75, they actually catch up to men. And after 85, they actually have a higher chance. And I think if you look at the African-American women after age 65, so much more obesity, so much more diabetes, that they definitely have a lot more concern for the heart blockage and heart disease. And I remember the study where when the coronary angiogram, cardiac catheterization showed a normal coronary arteries, but many of these women continue to have anginal or typical heart chest pain, and their stress test was positive. Many doctors actually dismissed that many times, that your heart is fine, but many of them have, like you said, small vessel, micro vessel disease, and they have a true angina. And many times, if this disease is not treated, they eventually can lead to the cardiomyopathy and weakness of the heart muscle and arrhythmia. So we cannot ignore a woman's symptom just because they have a normal coronary angiogram. And that's where I think some of the lifestyle changes, some of the medications, particularly lifestyle changes which increases this nitric oxide production, would be very important for vasodilation. So please tell us, if a woman wants to start doing everything right from tomorrow, What can she do in terms of lifestyle changes, in terms of seeing a doctor, in terms of watching the symptoms, and everything else you think you can think of?
I think it's important really to start with the basics. You know, if you do go into your healthcare provider, um, keep track of your labs and even the basic labs. I mean, I see people quite often now that haven't even had basic labs. Are you anemic? What is your thyroid? Especially in women, the thyroid it can be an issue, and it can even cause the cholesterol to go up. um, if you read and you ask, can I get some of these special labs, sometimes it is overwhelming for the primary care providers to be able to take care of all these labs, but they're trying and they want to try to get, the right answers for people. Not that we do routine EKGs, but I think there's many women that have never had an EKG, and men. And I think that at least if you have a baseline, especially if you have had some issues during pregnancy or had treatments, now it's a little easier because people that have treatments for cancer usually do have some testing. That if you're having symptoms, don't listen to people saying it's not anything. They really should listen. And it's not unreasonable to do an ultrasound of the heart if you're out of breath, or to do a stress test. So I think we have to be our own best advocate for pushing. Don't be shy, just say something's wrong, I need to be checked. And then also with finding answers, I mean, I think we do have to learn, and fortunately what you're doing is so important. Another book that I like to share with people is there's a series called Clean Gut and Clean Eats, written by Dr. Alejandro Younger, who's a cardiologist, functional internal medicine, or integrative cardiologist. And really it's the same things that we're talking about, is you clean up the diet, you get foods as close to the source as you can, look for foods that don't need a label because there's nothing in them other than what you're looking at, and find an advocate to teach you to have fun. You have to have fun with the food. Find a friend, a family member to help you do some food prep, to help you come up with ideas. But there's so much good information that you really just have to find what you can link into as being helpful for you. People ask me what I eat, and that's fine, but you have to experience what you like to eat, what makes you joyful, what do you look forward to, and then maybe try some things that you haven't had in a while. And so that's important. And it gets a little harder with exercise, because if people haven't been doing it in a while, that's where it's nice to have just what you talked about, basics. Just do 20 minutes of walking, 20 minutes of bike riding, getting up frequently during the day, because otherwise it can be overwhelming to try to do all these things. But those things alone can make a big difference. Those things can help the arteries relax. One of the things that women have problems with is that because of our body size, our arteries and heart can be smaller. And so if we do have blood pressure, or we do have diabetes or heart disease, our heart can stiffen. So then we can develop fluid overload because the heart might be squeezing okay, but it's not relaxing enough. And so we develop symptoms because our heart isn't flexible and pliable. And that's where exercise and nutrition can make a big impact. I think a plant-centered diet is critical. If people are willing to do what you've been advocating for and what Dean Ornish advocates for, and what I give people options, listen, this is probably the one type of diet that has been studied to show either the plant, like a vegan plant-based diet, or at least think about a plant-centric diet like Joel Fuhrman and like Pritikin and like Chip, where you give people options so you don't scare them away, and just say, you need to decide where your goals are, but you need to try more foods that are in that category so that you get more fiber, which most people don't get enough of. And it's hard to get enough fiber. And so that's where the plant-based foods become really important.
Wow, no, I think you outlined everything what a woman should do starting tomorrow. And I like I said earlier, women many times are the leader in the family. If women starts, the whole family starts doing the right thing. So I'm glad we are talking about helping the women pretty much every day. So let's ask you the last question. Many of our followers and viewers live in mid Michigan, and if they want to reach out to you for your guidance, maybe come and see you as a patient, maybe see what you offer, how can they reach out to you?
I'm located in the East Lansing area, and it's the Center for Optimal Health, cfohealth.com. And they can take a look at the website if they want. And we try to offer people options of, I do clinical cardiology. I don't do emergency-based cardiology at this location. And I try to do both traditional and integrative cardiology. And so hopefully that gives people some option. I do take some insurances, not all of them, but they can certainly look and see if that's something that they'd like to do. Anybody can do a carotid thickness test. In fact, people can self-refer if they want, but I want to make sure that they have a doctor to link up with after they get the results. So that's something that anyone can do if they would like to do that. It takes about 25 to 30 minutes. And the images are painless. It's just ultrasound in the region of both sides of the neck.
Wow, that's great.
Mhm.
Now, I think we definitely need more physicians like you, I think, who has interest not just into cardiology, but also into lifestyle medicine, functional medicine, integrative medicine. I think that's a future for America. I think chronic disease are on a rampage, diabetes, obesity, and only way we can prevent this healthcare bankruptcy and a lot of suffering. In the last 3 years, our longevity has gone down actually instead of going up. Last 100 years, it was going up. Last 3 years, it has gone down. So I think we definitely need approach which you have been taking it, for last many, many decades, but definitely for last 2 or 3 years with your place in East Lansing. So Dr. Williams, thank you so much. This was
Thank
great.
you, Dr.
I think
Shah.
keep bringing you back again and again. And
Oh, thank you.
always good to see you at the hospital. And
Yeah.
thanks for everything you do for us and for
And
me.
thank you for everything you're doing. It's really, it's very motivating. And I think we need an army of people trying to help, especially during this pandemic, lift everyone up and tell them they can be strong and we can stay healthy. So thank you so much.
Yeah, great. Thank you very
Yeah.
much.